is a much better approach than continuing to patch up the system that we have. And that's the kind of investment that we've been calling for. Similarly with Royal Perth, although a very difficult area geographically to work with, having that kind of commitment to something that will see us into the future and not cause disruption to the existing health infrastructure is a real good decision by the government. And so we're really excited. It's a little bit of celebration mode. I think it's been a long and difficult winter, and we've been saying we can't have another winter like this, but these are the kind of investments, announcements and changes that we needed to see in order to feel some level of comfort that things are going to get better. So this is good. This is a good news day.
It won't happen in time for next winter, though. I mean, Mount Lawley, aiming to get that, next year, but then, Peel Health, that's 2029 target date. RPH construction only starts next year, so it won't fix it next winter.
Yeah, so the addition of Mount Lawley Hospital to the public sector will actually end up giving it next winter. So it will have an impact next winter. How big an impact we will have to wait and see, but it's sort of in line with what we were asking around that 400 mark. Still going to need a lot of other strategies to make sure we get through next winter, but it will have an immediate impact, and we're starting to see that there is a longer term plan here around what the future of our health infrastructure looks like in WA.
Are you able to put in perspective for people what an additional 100 to 100 beds would do to the health system and why this is a good news day?
Yeah, look, an extra 200 beds will, I think an extra 200 beds will almost half ramping, I think would be my estimate. It's very hard to judge because a lot of factors go into it. But we're talking about significantly reducing waiting times for people to get in the front door of our health system, which is chockers, which is sort of bursting at the seams. So even an additional 200 beds heading into next winter means that people can get in the front door. They can get the care, they can get the assistance that they need. It will be an immediate benefit. People will notice that that waiting period and that ability to get in the front door will be improved. It's not going to suddenly turn everything into perfect, but it's a fantastic step in the right direction.
Long term, do you have confidence in the delivery timeframes? Peel, for example, since that redevelopment has thus far dragged on since 2020, flipping it to a whole new build, I mean, is 2029 achievable? Do the timelines really need to be tightly managed?
Certainly not my area of expertise. I think building a hospital definitely takes some time, and we want to make sure that it's done well. I'm going to give benefit of the doubt here. We're seeing announcements for investing in hospital infrastructure, and we know that will take some time. And we will work to keep the government to account on these promises and make sure that they do deliver what they've promised to. But at this stage, we're pretty grateful that they are listening. I mean, and that's the big, for me, apart from the investment in health, the big news for us is the government has listened and they have invested in health. They have made a change and put significant investment into our hospital system, which was sorely needed.
You said you're excited by Peel and that the new hospital there is better than patching up the old facilities. Do you think that's the best location for a new hospital? Is there still a need to perhaps increase availability in our more northern suburbs?
Yeah, and that's a piece of work that I look forward to the department and government sharing with us, which is what is the longer term plan here? This is a fantastic start, but what does 2030, 2040, 2050 look like? Because we know we will need something in the northern corridor for the population out there, as we will in the east as well. So whilst we are very excited to see this big announcement for Peel and for Royal Perth, the question becomes, what is the longer term plan? And we're happy to be involved and to be part of that. But again, the fact that we've heard them listen and implement some of these changes and investment into health is a fantastic starting point for the next couple of years ahead.
And there was a hint today that once the new hospital in Peel is built, the old facilities may be used or looked at for aged care. Would you like to see that happen?
Yeah, one of the other things we've called for is the government taking some more responsibility for aged care delivery, given it was one of the bigger constraints or causes of ramping this winter. And whilst we know it's a federal issue, we see it's somewhere the government can step up and show some leadership nationally. So we would not want to see the current Peel Health Campus suddenly not be used. We would welcome it being used for aged care once the new hospital was built. I think those are the sort of things that we need to think through in the next couple of years.
Is that Mount Lawley location a sort of strategically correct location for a public facility, given how close it is to Royal Perth Hospital?
Look, that's a tricky one. For me, the priority here is beds and access to beds, and so being near to other tertiary centres does allow perhaps some movement of patients between sites, which I think is a positive. So being able to have patients who are in ED at Charlie's or Royal Perth be transferred to Mount Lawley, it's a short distance, and so may offer some opportunity in that regard. It is still in a central location, and a little bit like our other metropolitan hospitals will have that problem of it's difficult to expand. But as a stopgap measure, or as something that can immediately add capacity to our system, it's a fantastic choice no matter where it is.
And can you just unpack the 200-bed figure that you were talking about? We've heard sort of a few different figures, 100 from the Premier, then that was down to 65. Can you explain what your calculations are?
Yeah, I can. So it's about 195, 197 beds. So I think, so we just say 200 beds for Mount Lawley. The public sector was already using about 65% of those beds as part of the winter surge plan because there was the availability. The beds weren't being used, and so that was something that had already been utilised by the government. However, out in Midland at the moment, there is a sort of reciprocal arrangement where St John of God were using some public beds for during the Midlands St John of God's expansion at Midland, and so they will come back under the public sector management at about the same time. I think it's actually end of this year, and so it does sort of a kind of almost like for like mean that it does end up being 200 more beds back under the department's control, back in the public sector, if you like.
But really it's just 100 beds or potentially less linked to that Mount Lawley acquisition?
Well, so we'd be all 200 there, just I guess some of them were already being used, but they weren't under the governance of the hospital, right? And so there's some inefficiencies there in getting people into the hospital and also getting them transferred out. So you do create a little bit of a problem when you're got an agreement to lease beds rather than running a hospital. So you will get all 200 of those beds, plus a little bit more control around the patient flow through that. So it is still 200 beds.
$1.5 billion is a lot of money, but is it enough to fully cover all those three projects? I mean, a new hospital at Peel, the new women's hospital is $1.8 billion. And so then add on that a new block at RPH, add on that buying the Mount Lawley hospital. Like, $1.5 billion is not enough, is it?
No, I think 1.5 billion is amazing. Whether or not that covers all of those projects, again, really difficult for me to comment on. But the early numbers of what Peel might look like suggest to me that it's quite a significant investment for a hospital of that size in that location. I think the women's and babies cost is quite a different one, given it's quite a specialised and large hospital, and so it comes with a slightly different price tag. So no, actually, I think the 1.5 billion here should more than make an impact on our public hospital sector.
Can I just ask you about the AMA hospital report card out today as
Yeah.
well? I know it's the national one, but found West Aussies presenting to EDs with mental health at the equal second highest rate in the country. How concerning is the mental health impact on our hospital system at the moment?
Yeah, so and none of this is new. None of this is new really for us. Like, we know that one of the issues that has led to ramping, that has led to the logjam in hospitals, have been mental health presentations amongst many other factors, and that's what we're seeing with a publication from the federal AMA today, is that there are less beds per 100,000 for mental health patients, that people are accessing more services and are waiting longer to access those services in mental health. So we know that's part of the problem. And again, it's good to hear that in the plans for Peel, as an example, is a mental health unit. So that's an additional mental health unit put into the public sector. And so it's good to see, again, some bricks and mortar solutions, some beds when we've been asking for beds, and even for that to be within the mental health space is pretty welcome by us.
Is the key, that more needs to be done in the community to avoid, mental health patients inevitably stay longer in the hospital system?
Yes, that's a complex one. But I absolutely agree. The model for improving mental health care delivery is not one of just more beds, but we still do need more beds because we can't deal with the current acute presentations, and that's what That's what this review is telling us, and telling us very clearly. It's also saying it's not a unique problem in WA, but a problem across the country. However, it's not the only part of the solution. So whilst, yes, we do need new beds, we need to make sure we're managing people in the community where appropriate, that we're intervening earlier, that we're looking at those preventative measures, tackling things like domestic violence, like homelessness, alcohol and other drugs, things that lead to disease burden across the breadth of medicine, but do have a significant contribution to people's mental health and well-being. That's where we're going to have the biggest impact, and that's the part where I'd really like to see future investment focus, really, is on this health promotion or health, preventative strategies around keeping West Australians healthy and reducing the need to be in hospital in the first place.
And 10% of admitted patients spent nearly a full day waiting in the ED. I mean, how bad is that, and what's the primary cause of that?
Yeah, the primary cause of that, this is probably twofold. I'd say people. That's a hard one. The main reason the length of stay is quite long for mental health presentations.
Sorry, that's not mental health.
Anybody?
Overall, patients who are admitted to the hospital from ED.
That wasn't in the one today, was it?
That's what I've been sent. It says 10% of patients who are eventually admitted wait nearly a full day, 21 and a half hours in the emergency department.
That was mental health patients. So.
Was it?
Yeah.
Okay.
Yeah,
right,
yeah, because that was looking at just mental health, that public hospital review. Yeah. The largest reason for that is the access to beds, which is why we are pretty dogged in consistently saying we need more beds, because if there's someone who is acutely unwell and needs to go to a specialist unit, but there is no capacity in that specialist unit, where do they go? And that's been the big issue that we've faced, is that we don't have enough capacity to deal with the acute end, and so that's why people wait. Once we get to the part where we can, that's where other services are going to make more of a difference. That's where our community intervention, that's where our preventative health really does start to shine. But we still have this problem of people accessing care now at that acute level, at that highest level of care, which, again, I'm pretty grateful for today's announcement, because it acknowledges that. It acknowledges that we do need health infrastructure, that we do need beds, and that we do need the money invested into trying to solve that problem.
A good news day. Obviously we're going to soak it in, and like Jesse said, we've got a few more years until everything's online. But what is the next step in terms of how you see us starting to fix this now? Hopefully get Mount Lawley in 2026, but what does the government need to look at more in the short term now? What's your next bite? Yeah.
The big thing I'd like to see is what is the longer term plan. I'd really like to know, what does 2050 look like? I would really love to champion that health infrastructure and health delivery is a bipartisan approach, that we take the politics out of healthcare delivery, so that we don't have to have the tit for tat between our political parties over something that is key, that is crucial, that is important to everybody. I believe health shouldn't be a political issue. I believe it's something we should have a solid plan for, that both sides of politics agree to, and then deliver on. And I think that's going to be absolutely required if we are going to see long-term change. Otherwise, are we back here again next year or in 2032? That's my concern. To prevent that, I'd love to see long-term planning done by both sides of government, with a commitment to health has to be a priority. It has to be, and that's what people want.
Can you just tell us how acute right now is the crisis in our public hospital system?
Yeah, so during winter, it was awful. Like frankly, it was awful, and I hear that from our members. When we were meeting with the other unions, they're hearing the same thing. We were not exaggerating when we said we really can't have another winter like the one we've just had. So the word crisis almost feels a little light in terms of just how serious things got. It has been better in the last couple of weeks, and that is typically what we would see. Once the winter pressure eases, pressure on the hospitals eases, and so the last couple of weeks have been a bit of a chance to catch a breath, a bit of a chance for our doctors, our colleagues, our other hospital workers to kind of reset and look towards next winter. The Department of Health did meet with all the union leaders after our press conference the other week, and so we do feel engaged. We do feel that they are listening, and today's announcement hopefully goes a long way towards seeing that as a more long-term solution, a long-term viable solution. So yeah, it feels like we're on the other side of a pretty tumultuous, a pretty disastrous winter. We can't have another winter like that, and something had to be done. Something was done, and that for me is at this stage, that's kind of what we're asking for. We've been asking for them to buy a hospital. We've been asking for them to invest in new beds, and they've delivered on that ask. So we're pretty grateful for that.
There's sentinel events, if you will, indicating this crisis was coming, have been in the mix for years, though. Is it taken the state government too long to act?
Well, yeah, I mean, in as much as it's not a new thing for us to be asking for beds, it's not a new thing for us to be highlighting ramping as a canary in the coal mine for what's happening in our hospital system. So we have been asking for a while, and I think for a period of time there, we felt a bit forgotten, a bit sidelined, a bit adrift. So yes, this could have come sooner, but it's still, there's opportunity to do nothing or to realise where you've either erred or made a mistake and then step up and deliver. And I feel like this is an example of that. Yeah, that federal one is the public health review for mental health. Yeah, it's fine. It's a very dense